So we're using shockwave around the knee joint, helping break up adhesions within the muscles that surround the knee joint. What's up, Orlando? Dr. Jones here from Infinite Wisdom Chiropractic, and today we have Rosa down on the table who came in with knee pain. She was experiencing right knee pain. The X-ray and MRI showed degeneration, and it was bone on bone. And we've been working with her through our knee restoration protocol to really help create space in the knee joint so that she's able to move more freely again. She was managing this with injections, which were doing pretty good, helping her relieve the pain, but we're trying to get a more natural solution where we can work with the body and the muscles to help decompress the knee. So that's what we're doing. So today I'm going to show you how we've been working with Rosa to help create less pressure in that knee joint. So first thing that we do when it comes to knee pain is we always check the pelvis and the alignment of the hips. We always got to look at the body as a whole. So the right pelvis is actually higher than the left. So the first adjustment we're going to do is bring down the right pelvis. So we're going to use our drop table here. Nice and gentle. So we're adjusting the right side of her hip and we're bringing it down to create balance so that the knee joint can be supported. Any pain here? No pain. Great. So we have been working on utilizing decompression adjustments for her knee. Again, she came in bone on bone. So the first step to correcting this is balancing the hips out and then decompressing the knee with a specific adjustment. So we're going to do this right now. We're just going to simply get some motion in the knee joint, find where it's stuck, where it's out of alignment. Yeah, right there. So you feel this on the inside, Rosa, right?
Yes.
Okay. So we have to put it in and then a little pull. Deep breath in. Good. Let it go. Perfect. There it was. Beautiful. All right. So the purpose of this tool is to get deep into the joint and start to get blood supply to the areas of the knee that have poor blood supply. Now, blood supply is really important for healing and the healing process. So if you have ligaments and tendons and cartilage within the knee joint, it doesn't get good vascularization. So we need to use this tool to start to initiate the healing process in that knee joint. So we're going to start this up on Rosa here, and we're going to go into those tender areas. For her, it's more inside the knee here. So we're using shockwave around the knee joint, helping break up adhesions within the muscles that surround the knee joint. And again, trying to get as much blood supply to that area as possible so the healing can occur. So now we're getting into the joint lining. On the inside is where Rosa feels the most pain, and it's where the most degeneration is shown on her x-ray. So we want to be able to put as much sound wave into this area as possible so we can get the blood flow there. All good. No pain?
No.
Great. So no pain here. Last step of this is just getting fluid motion into the joint. So we use chiropractic care, step number 1. We use shockwave, step number 2. And now we're just pumping that joint to try to get as much synovial fluid in there as possible.